talk about the risk factors concerning breast cancer, we have two major types. They are the ones that you can control and the ones that you cannot control. In delving into the ones that you cannot control, they include 1. Age. Your risk of breast cancer increases as you age. Most cancers are found in women aged 55 and older. Secondly, gene mutations. Changes in genes linked with breast cancer, such as BRCA1, BRCA2, and other increase your risk. Gene mutations account for about 10% of all breast cancer cases. Also, dense breast tissue. Having more dense breast tissue and less fat breast tissue increases risk. Also, dense breast tissue can make tumors hard to see even using the mammography. Exposure to radiation. Treatments involving radiation therapy, especially to the chest wall as a child, can increase your risk. Family history of breast cancer. If your mother, sister, or daughter was diagnosed with breast cancer, you have a higher risk. Personal history of breast cancer. If you have had breast cancer before, you are also at risk for the breast cancer coming back. Furthermore, personal history of ovarian cancer is also one risk factor that you cannot control. Abnormal cells found during biopsy. If your breast tissue was examined in a lab and had abnormal features but not cancers, your risk is also higher. Reproductive and menstrual history. Getting your period before age 12. Starting menopause after age 55. Getting pregnant after age 30. Or never getting pregnant at all also increases your risk. And now to the risk factors that are within our control. 1. Radiation therapy. Radiation therapy to the chest area before age 30 increases your risk, so you can take note of that. Secondly, alcohol intake. The more alcohol you drink, the greater your risk. Long-term use of hormone therapy. Taking estrogen and progestin together for menopause for 5 years or more increases your risk. It is not clear if or how much taking birth control pills that contain estrogen increases your risk. Weight. Overweight women or women with obesity who have had menopause have a higher risk than women at healthy weight. Also, physical inactivity. Women who do not exercise regularly throughout life may have an increased risk. So, these are the risks that are beyond our control and the ones that are within our control. So, let's be guided and take notes and make healthier life choices.